Hello, I'm Fara Sax with Community News, and I have the pleasure today of being in West Kendall with Dr. Wentworth Jarrett. He is a family practitioner with a holistic wellness center, and we're going to learn more about his business and what he practices and how he helps his community in so many ways. Dr. Jarrett, thank you so much for joining me today.
Thank you, and you're certainly welcome here, and we're glad you came to visit us.
Not as a patient, but the patients that do come, talk about a little bit of the practice and a little bit of what you treat and how you got your beginnings. Did you wake up one day and say, I want to be a physician?
Actually, no. I throughout my early years, I thought I wanted to be somebody who could help people and still make a living. And it's interesting. I remember talking to back then my Baptist minister who said to me, "You don't have to be a minister. You can do anything. You can be a lawyer. You can be a doctor." And interestingly, because I was good in the sciences and in school as well as the art stuff, um, I was encouraged to pursue medicine, which is what I ended up doing. And it kind of worked out that I achieved both because as you'll see, if you walk around my practice, it's pretty eclectic. We have art everywhere. We have music, and we have a holistic practice. And I think that represents who I am as a doctor.
And when you went to school, was holistic practice something that was part of the curriculum, or is it something that you've adapted and adopted along the way that you've incorporated into this beautiful facility?
We have evolved. When I went to medical school, it was pretty much the sciences, but also a methodology of how we take care of our patients, making sure that we figured out how to talk to, touch, and interact with our patients physically and mentally. So the holistic part of the practice kind of evolved. Interestingly, even the spa that we have, I remember it wasn't something that was intuitive. I went to a spa treatment. I'll never forget it. It was about 1985, 86.
You were about 3 years old then, right?
Yeah, 3 years old, clearly. Went over to, back then, the old Doral. I'll never forget. Went to a spa treatment where they had a yoga session and they had lunch. And I'll never forget that the first time I had a clinical massage, I fell asleep. And I remember the therapist waking me up and saying, "Dr. Jarrett, time to wake up." And I said, "Man, this is the greatest thing." And as the practice evolved and I had the opportunity, since we're building out our space, to think about how we would incorporate this opportunity to have patients have this holistic experience, I said, I'm going to put in a facility that will address not only the medical didactics, but also the whole holistic part of massage and facials and we have an infrared sauna, for instance. This is all part of, it's not atypical medicine. It certainly helps patients as part of the continuum of what we do. So this was part of our evolution.
And growing up, you didn't grow up in the States. Did that influence anything that you brought to medicine and moving forward to our time together and how you practice medicine?
Absolutely. I think even though I grew up in a country that after I was born, it became independent, but we grew up in a very British-style educational system and then medical system.
Where was that?
Jamaica. I went to the University of West Indies, and it was a very traditional kind of medical training program. But we're also we were taught how to be holistic doctors, asking questions, touching our patients, listening to our patients, and understanding that a patient's well-being was not only based on whether they're hypertensive or diabetic, but what was happening in their family lives and their family structures, or how they ate, how they lived, how they exercised. And so this is part of what we do in our practice. We try to incorporate all the things that I learned as a child.
And it's family practice, there's a spa, there's clinical research facility, and it's all housed under one umbrella.
Yes.
What does that mean to you, and why do that?
It means that there is a continuum of understanding what healthcare is. When we have a patient who might need interactions and assessments of their health status, when we do clinical research, people come to me because they trust that I'm telling them I'm being honest, and we incorporate all the different aspects of their health and understand that they might benefit from participating in a clinical study that's a sponsored study. That might be about diabetes, it might be about hypertension or women's health issue, but certainly that is very much part of practicing what we do. For instance, we're looking at studies on lipid abnormalities, lipoprotein little e studies.
What is it? Explain that in layman terms.
Layman terms, the risk factors for arteriosclerosis or cardiovascular diseases might be partly related to metabolic abnormalities that can be modified with medication and or drugs. And these things have to be studied. And the patients who are most at risk frequently are patients who are exactly in this community that we serve and who might not go to a fancy smashy spot that's in the Gables, but they'll come to Dr. Jarrett, who they trust and who has been here in Miami, in West Kendall, in a facility that hopefully they'll perceive as being top tier and not certainly taking a step behind anybody else.
And we were talking earlier, and I was talking to your staff, and some of the patients are between the ages of 17 all the way to centenarians. What do you treat during your day-to-day with your patients? Like, what kind of patients do you see for people that are looking for a physician and maybe a more holistic approach that seems to be your goal and your ambition?
Well, first of all, holistic does not mean that this is not evidence-based traditional medicine by any means. Holistic means that we're looking at all the different facets that might influence healthcare. And that's what holistic means to me. It doesn't mean that we're prescribing salmon with ginger and
that's good though. It
is
good.
Amazing, but it might not be considered the only necessary treatment for hypertension. However, we will understand
So
that
it's the traditional.
it's traditional, along with understanding if, for instance, a patient just sent me a whole ream of data on why he might not want to use statins, even though there is certainly clinical suggestion that he would benefit. But he did research, he has stuff from Oxford University, he has stuff from Harvard, and interact with physicians, even though he has cardiovascular disease. But I respect his desire to use a different path to his healthcare goals, working in the context of understanding that there might be a different perspective.
And that's really nice that you have an open mind and that you're working with your patients as a communication to the betterment of their health, which is really so important.
Absolutely. And I would like to believe that more doctors would give their patient the opportunity to participate in their healthcare. This is not by any means a dictatorship. It's a program where we work with our patients trying to understand what their perspective would be and try to address their healthcare continuum in the context of cooperation and collaboration.
And we're sitting in a beautiful Three Lakes, which is sitting on actually a beautiful lake. We'll probably see some video as we move forward in our interview. And it almost feels like a very relaxed. When I walk in here, I feel really relaxed. I feel like there's the spa element, but there's a gentleness in this place that I feel like I'm going to be okay. And I don't know if it's because it's a spa feeling, or it's just what you've created along the way, the beautiful artwork like you were sharing with me. But talk more about that as an integral part of one's feeling at home and feeling healthy and getting better in this environment that you've created.
It's important that in any environment that you create, that you spend the vast majority of your life, that you create something that embraces you and surrounds you with calmness. And when the fact that we own our space, we built it out. It's a little eclectic, and some people might criticize my architectural eye.
But don't people criticize anyway?
Yes, exactly. So when I decided to build this place out, I remember my contractor, who is still my patient. He was seeing me at my old practice, and I told him, when I build my space out, I am going to get big doors. I'm going to raise the ceiling. I'm going to use light colors, and I had very specific ideas about what I wanted to do. And so, for instance, the doors, we brought them in on a flatbed truck from, I think it was not Calgary, but close. And that's for real. And the guys who stained them, I wanted to pay homage to my Jamaican heritage. So we did a cherry mahogany stain on the doors by hand. They did anyway. And the ceilings are 10-foot ceilings on purpose. So when you come in, you don't feel squenched in. In our waiting room, on purpose, we opened it. There's no window. We had to put up plexiglass during COVID, but we made it open. So patients sitting in my waiting room would view it not so much as a waiting room, but rather like a living room, a parlor, where they could see what was going on and people could see them. We have a fish tank that has traveled with me from all my various offices, and we incorporated that into the wall in my waiting room. And that was done on purpose to create an environment so that patients would, on walking in, not feel like they're going into a medical office to get bad news, but rather going into a place where they were kind of going home or going to. We don't serve tea, high tea, not yet, but we might.
That's so funny. I love that. And let's talk about that Zen feeling. Let's talk about the spa. What services are offered and what people can expect, and what kind of royal treatment for maybe high tea in the spa eventually.
Well, I tell you, when we first created the spa as part of our wellness center, we decided, at first I was thinking of accessing patients who might want to come from international locations, whether it's Latin America or Caribbean or Canada, who might want wellness care in the United States, but also wanted a setting where they would have like an executive physical type of setting, where this would be part of the whole process, including the transport from their hotel by limo. I have limo drivers as patients as well. And we'd bring them here. They had to have their physical, which might include their blood tests and their pap smear if they needed it, the arranged specialist appointments. And as part of their physical day, they would also have a spa treatment. This was all part of my original strategy. And this would be all. And when they left and went home, we'd send them a dossier or with all their data and everything when we had everything in place to their wherever location they came from. That was part of my international concept about this wellness center. For our patients here, whether they're a Medicare age group patient coming in for a wellness visit or a young whippersnapper wanting to get a touch of Botox, a little filler here and there. These are all options that you have in this practice. That's anything but traditional, I think. We also we have, like I said, infrared sauna, which actually has a lot of interesting data as part of the whole wellness thing. Massage, obviously. So this is all part. I don't view this as being necessarily different from my medical practice. It's just part of what we do. The research, well, that's different in a way because it's sponsored studies typically. But this, again, is all part of what we offer in our wellness center. So my son is a family doctor as well.
So it's second generation.
Well, yeah, as I was explaining to someone earlier, I view myself as a custodian of time. All I'm doing is holding on to the spot until the next generation, the stormtroopers arrive and take over. Because I have a lot of confidence in the future of our young people. I think they're going to come in and they're going to be fine. But they have to have a place to come in to rescue. And I think my son, and I have two sons who are doctors, and we know a lot of patients who we have shepherded through our practice who have gone into medicine or nursing. People will have a place to go as the custodian, just hold it for them.
Dr. Jarrett, it's really been a pleasure to be with you here today, and thank you so much for all you do in this great location in West Kendall, easy access to get to, and serving our community, and thank you so much for our time together.
Thank you for coming in, Miss Ridge. Mrs. Sax.
All
right.